Welcome to the life you crave. Simple and sustainable weight loss for women who have better things to do than diet. I'm your host, Leah Pinelli. I help ambitious, badass women stop overeating, overworking, and overgiving to lose weight from a place of love. I'll help you simplify weight loss, end your overwhelm, and create the life you crave. If you like what you hear, please like and subscribe to this podcast. Let's get started. All right. Welcome. You guys, I am thrilled, beyond thrilled today to have as a guest, Dr. Gail Jackson. I met Dr. Jackson at an event recently, and I just knew, I was like, I have to have that woman on my show because she is an expert in what I'm struggling with right now and what I know so many of you guys are struggling with right now. And so I'm thrilled to have her on. Let me just tell you a little bit about her before I have her jump in. Dr. Gail Jackson is dedicated to restoring the well-being of women in this phase of life. And if you're listening, you know what this phase is. With more than a decade of documented research and positive results, Dr. Jackson has the solutions to restore your well-being in this stage. And let's just say it, menopause, right? Premenopause, perimenopause, the whole thing. So Dr. Gail, I would really love to begin. You say that you have the answers that we deserve. I'm like, my hand is raised. I'm like, what are those answers? Please share. I would love to hear.
You know, in one word, the answer is testosterone balancing. I am a little bit about me and my history because we didn't have a chance to talk a while, and maybe these ladies haven't met me. Instead of reading my bio on my website, they can get it from me. So I have over 30 years of experience in Western OBGYN. I'm on staff at Cedars-Sinai. My office was in Cedars-Sinai. I did deliveries, I did surgeries, and probably about over 15, almost 20 years ago, I had patients and friends, girlfriends who were older than me, who were miserable. And there was nothing in the Western text that was available for them. And I knew I had to do something. And then I changed my practice focus at that time to hormone balancing, menopause wellness. And I knew there had to be something out there that was safe and convenient and effective, because everything out there was fraught with complications and side effects, all the artificial and synthetic things. I didn't want to take any of that. So my friends and my clients who were older than me, I didn't want them to take it. And, selfishly for me, I wanted to find out something. So when it was my turn, I would be ready. And fortunately for my patients, my menopause was miserable. So everything that I offer in my office, I've needed and I've done it myself. And as I always say, I'm that girlfriend who tells all her secrets.
Yes. Oh, we need more of that.
So a lot of the questions that are asking me are, how do I lose weight? How do I handle some of these nagging symptoms that we really don't talk about that often? Let's talk about them now. Irritability, mood swings, low libido, weight gain, mushy muscles, difficulty sleeping, memory loss, brain fog.
Yeah.
Just edginess, anxiety.
Oh, and vaginal dryness. Don't forget that one. I know you've got the lips. Yeah.
Yeah. Those symptoms are related to low testosterone. And if you're like most women and many physicians, they feel that testosterone is a male hormone. But guess what? Women need and love about 10% of the testosterone that men have. And that 10% is life-changing. So women knock my door. Well, let me back up. Those symptoms are vague and sort of subtle. They're irritating. And many of them women kind of live with it. They just totally can live with it. But they want better. They knock the doors down, however, with the hot flashes. Because you can't. You're at a meeting, you're at a board meeting, you're trying to speak, you're trying to present, and you just start dripping in sweat, and often are ridiculed about it. So the estrogen part of hormone balancing is helpful for the hot flashes, the night sweats, the dry skin, the crepey skin, and the vaginal dryness. So it helps those things. So those are some of the key hormones that are out of balance during the perimenopause through the postmenopause phase. And some of those symptoms start as early as the early 40s. We have a lot of ladies in their early 40s who simply come to us because they really just can't lose the weight. And that's when the conversation, that's what started our conversations, because that's your area of expertise.
That's right. That's right. So now tell me, you're talking about hormones, which is my language, right? Because that's what, for me, decades and decades and decades of yo-yo dieting. And when I finally learned, oh my goodness, this is hormonal. This has to do with my insulin levels and my blood glucose levels. And once I can kind of play with those and get those stabilized, it changed everything for me. But now at 46, I'm moving into a different phase of my life where I could have all the knowledge in the world about what used to work for me, but it changes when we hit this, 45 to 55 range for most of us. So what I'm curious about, Dr. Jackson, is when you say it's a testosterone issue, it's a hormone issue, are we talking about hormone replacement therapy here, or is this something different?
Well, in the mid 40s, the testosterone production from your ovaries and your adrenals begins to decrease. So it is a hormone deficiency. And we're talking about hormone replacement. However, what's the difference? This hormone replacement we offer is plant-based, yam-based. So it's not fraught with those often fatal side effects.
Whoa. I did not realize that. So it's plant-based HRT, is that right?
That this is correct. So bioidentical HRT.
Wow.
Bioidentical HRT, and this is functional medicine, so this is not Western medicine. Right. So don't be surprised, alarmed, or disappointed when you go to your practitioner. I used to be one of those, and ask for BHRT or ask for some of these solutions, and they'll just say, oh, it doesn't work, don't do it. Because often when doctors are not up on it, they're down on it.
Yeah.
So this has been our area of expertise for I was counting the other day, almost 20 years. This is just what we do. And selfishly, because it's what I needed, and I wanted to be safe, and I wanted something safe for me and something that worked.
Yeah.
Which just reminded me, I was wanting to get my pellets today, and I just can't. Right? Something has happened. Anyhow, so
what happened? What does it look like when you have a woman come to you and say, "Okay, Dr. Jackson, I am really struggling with like this weight that won't budge, or all of a sudden sex has become real painful, or what hot flashes?" Because I know for me, at least in this process, it's been a lot of run around with, okay, we don't know what these symptoms are. Like, let's go to endocrinology. Let's go to, there's been all kinds of referrals. And then there's suggestions that, well, it could be because you're 45 or 46. And so a lot of times it's difficult to diagnose or to get answers. So when women come to you and they've maybe got like a myriad of symptoms, what do you do? I mean, it sounds like you first and foremost listen to them, but what do you do? How does working with a doctor like you differ from, say, going to my own OBGYN or my own GP?
Well, like you said, the first thing we do is we listen. We have a complimentary consultation, but it's very formalized. It's a long, well, not long, but it's an information sheet that gives me a little history about you. Then we ask you to get some baseline labs. So we'll just kind of know exactly where you are. Your estradiol level. That's the estradiol when it's low is responsible for the hot flashes, night sweats, dry skin, dry vagina. Then we also ask for the testosterone level. Again, those symptoms: irritability, mood swings, low libido, weight gain, wishy muscles, losing that waistline, irritability, difficulty sleeping. And then we ask for a FSH, and the FSH is simply a yes or no hormone to let us know where you are, if you're perimenopausal, in menopause, or where you are. And then we also check your thyroid in the form of a TSH, the thyroid screening stand. So we have a consultation, a nice conversation, relaxed, probably 30 minutes, where we go through all the symptoms that are concerning you. The ones you've checked, yes, I ask you to quantify 1 through 10, 10 being worse. For instance, if you said difficulty sleeping, I ask you 1 through 10, 10 being worse, so I can get a sense of how significant your symptoms are. And then we talk about your labs. And then I explain more about the hormone balancing we offer and what's different about it and what we can look for, and then answer all the questions. And then we have the ladies come in and we do the hormone balancing. Now, we do it in a novel way. We offer hormone balancing in the form of pellets, and they're the size and softness of a kernel of cooked rice, or like basmati. So we place them. It's a little procedure. We place them painlessly after a lot of good anesthesia, local anesthesia, in the upper hip area in the back. So like your thong line in the back.
Yeah.
So when you wear your thong bikini on the beach, you won't see my little signature there. But it's really just a little. If I took my little pinky nail and just kind of pushed it in your skin, that's what the incision looks like.
Yeah.
So after the great anesthesia, I opened the little area, very small, and I put a little inserter there, and I put the pellets there, and then an estrogen pellet and a testosterone pellet, and then I sew it up with an absorbable suture, and you go live your life. And so there are 3 reasons why we select pellets as our little niche practice, because they're pills, creams, patches, etc., that are plant-based. Number one, it's all about you. Convenience. You come in our office every 4 months, you're good to go. Nothing that you have to dose daily, multiple times during the day. Number 2, when we give it to you directly underneath your skin, it goes straight to the target receptors. Doesn't have to do the circuitous route throughout the body to get where it needs to go. Number 3, we bypass the stomach and the liver. The stomach, anything presented to the stomach has to be coated so the stomach acids don't destroy it. Anything presented to the liver can cause an estrogen, specifically when it's presented to the liver, can cause an increase of clotting factors in the legs, which could increase your risk of having blood clots to the lungs.
Yes.
And also the liver could change the estrogen to a form that's not quite as safe. So those are the 3 reasons why we choose the plant-based, yam-based hormone balancing in the form of pellets. And overall, plant-based hormones do not increase your risk of breast cancer, but they're not going to protect you from breast cancer, because we really don't know all the multifactorial reasons why a woman has breast cancer, develops breast cancer.
Right. Okay. Yes. So let's talk about that for a minute, because I do know that you have quite a bit of experience with women who either have a history of breast cancer in their family, or maybe have actually have survived breast cancer themselves. What can you offer to them? Is it the same thing? What would you want for them to hear from you?
Well, if a patient has a family history of breast cancer, and she's miserable and wants hormone balancing, it should not be withheld from her. This is the method she should choose, because the studies show this does not going to increase your risk of breast cancer. And we really watch it in our practice, and we really have the clientele that should have a higher risk of breast cancer. We rarely see it. And often when we see it, it's something like someone who smoked for 20 years, or someone who has a strong history of breast cancer. So it's really definitely not as prevalent in women who are using hormone balance. Now, if a woman has had breast cancer, if it's not an estrogen receptor positive breast cancer, she can use it. We always want her to consult with her oncologist. But however, we also offer other little touch-ups, I should say, or perk-up ways to sort of perk up the area that are not hormone-based at all.
So tell us about those. What are these perks?
Well,
I want to hear about those.
We have a lovely little procedure, if you will, called the Lady Lift. That's our little pretty name for it. If you want to Google it, it's called the O shot. However, we focus more on the vaginal aesthetics and the bladder support than igniting the clitoris, because most of our ladies who get the Lady Lift also are getting testosterone, so they don't really need the stimulation to the clitoris. He explains it. He focuses a lot on the clitoris when he talks about it. But however, so if you have the gotta goes, and I tell ladies, it's gotta goes, be proud. That's a badge of honor. Because if you got a kid or 2 and a boo, you're peeing. You're just not talking. You got a little pee pad, you got a little extra tissue just in case, or you're running to the bathroom, or hoops in there, gotta go.
Right.
So if many women are familiar with PRP, microneedling of the face. Some athletes have had it in their knees. And so we use the PRP, the magical PRP, and we insert it underneath the urethra, which is the opening of the bladder, and it improves bladder support by 80%.
Wow.
And when we're down there, we have extra, so we pucker up those lips. She needs a spa day.
Wow. Yeah.
So what PRP is, for those who may not know, we draw your blood just as though you were getting a test for cholesterol, and we get rid of the red cells. So what's left is this beautiful liquid fluid we call it liquid gold. That is the magical fluid that the body uses to heal itself. When it's activated, it can be injected in any part of the tissue and it regenerates that tissue. Oh, wow. Let me give you some examples. When Kobe shredded his Achilles, he tore his Achilles, it was too shredded for him to have surgery. He had PRP injections and then was on the court and had that 60-point game.
Oh,
so
wow.
I had it injected. I've had it in my knee. When my knee wasn't healing totally, I had it and it just I was back in my Louboutins in no time.
Right.
So we use the same product. We use the PRP and we use it in the vaginal area. Many women get the microneedling of the face. Okay. Yep. So same thing, same PRP product.
Got it. So now in your experience, how have you seen this process change women, right? Because I'm imagining that here I am and I'm coming in and I know because I'm beginning menopause myself, it does not feel good. And like you said, it was miserable for you. And then they come in and they get the pellets and they start feeling better and they maybe get a little bit of a spa day, and their vajayjay. And then how do you see that transform them? Not necessarily just physically, but I think psychologically and emotionally. What have you seen it do for women?
She just becomes more fabulous. Every woman's fabulous, but I think that's what gives me the greatest satisfaction in my practice is just seeing women ignite and just flourish and just be exactly who they can be, irregardless of any age. If I have two patients here, let's say about 60, and if one's getting her hormones, she probably looks maybe 40-ish, and the other 60 looks 60. So it's really clear. It's funny when I run into women like, oh, I don't need that. I've been through menopause. I look at them and I'm like, yeah, you do. Yeah, you do. Yeah.
It makes a difference. It makes a big difference.
It does.
And it sounds like it really brings the pleasure back, right? Like it sounds like so I'm really big on the pleasure factor in general. And I don't just mean sexual pleasure, but I mean for me, when it comes to food, when it comes to life, when it comes to relationships, it's really about pleasure. Like that is what drives us as humans is pleasure. And so when you're really talking about, plumping things up and rejuvenating, to me, that's like, I'm thinking that is going to bring back such a pleasure factor because I'm going to want to be sexual again, maybe if my libido has been low, or I'm going to feel better in my skin. And therefore it's going to inspire me maybe to take different actions that might actually enhance the quality of my life versus just, having had a little procedure done.
That's well said. And what I share with women is I said, just because you're not having sex, you should feel like you want to have sex. And when you look vibrant and alive, you attract vibrant energy. You attract men. My ladies get into a lot of trouble. It's really fun. And if you're married, and I love it when we ignite a marriage, because women who've been married a long time, they go home and they start saying things to their husband like, who are you? So
where did she come from? I haven't seen her in 30 years.
I have a couple of husbands that got together, I think, over drinks in the ball game. And one of them told me, they said, you know what, we're going to build Dr. Jackson a house in Palm Springs. And a lot of them call here's the credit card. She's on her way.
Okay, so I've got a question. Okay, before I jump to that question, I want to know, you are using plant-based hormone replacement therapy, as a term. Why are more doctors and professionals not doing what you're doing?
It's a choice. I can't criticize them. I felt the need and the drive 20 years ago when my patients and clients were miserable. And I just felt that need. So I always tell my clients, I said, don't feel less than with your gynecologist who doesn't know it. They probably are expert in robotics and laparoscopy, which I never could grasp robotics. So everyone is something that drives you, and you tend to have your practice focus, and whatever that is what it is. So if the thing is, if your doctor, your gynecologist or whatever, is not aware of some of these things, just start asking around, research, and you'll be able to find someone who has a specialty and who has the information that you need.
Yeah, because that was one of my questions is do people have to fly all the way to California to get what you offer? What would you recommend to people?
Well, people get pellets. They can Google hormone balancing pellets because the provider, the gentleman who trained me a while, they had people every place who were doing it. So you can just probably Google bioidentical hormones in the form of pellets and select a provider. Let me caution you, however, because there are some people who, well, let me just give you a comparison. If you think of ibuprofen and you think of, what's it called, Advil, Aleve, or whatever. So ibuprofen is the same. People put a name on it, Advil, Aleve, or No More Hurt, or whatever. They put a name on it, but the generic is ibuprofen. So they're pellets, and there are people who put a name on it. And I'll caution you because there's, someone who decided I'll teach this to people and put my own name on it. One's called BioT. Well, people go and take a weekend course. Okay, a doctor, nurse practitioner, or whatever, and they go take a weekend course and they can do this, and they have someone, they send the labs to them, the folks tell them what they should do, they do it. The problem is, if you're going to select someone to give you pellets, I would encourage you to make sure it's a gynecologist, because we've been managing women, managing abnormal bleeding, because as I tell me, you will bleed or you may bleed. There's a high likelihood. So you want to be in the hands of someone who manages bleeding.
Absolutely.
I had a colleague that kind of found out what I did. Her specialty is way far from what I do. And she decided to take it. She started calling me about her bleeding patients. I told her, I'm not going to take care of them. And she says, well, what do you do with your bleeding patients? I said, they don't bleed. She said, what do you mean? I'm like, well, first of all, I'm going to examine them. I can do ultrasounds. I can do all those other things as a gynecologist. And if they bleed or spot, I can check the lining of the uterus and change their progesterone and those things that you learn when you have medical boards in the specialty in gynecology for 30 some years that you can't learn over a weekend. And someone that you send information to, which I found out she was sending her information or concerns to someone, and they were giving her directions that were far away from the standard of care of gynecology. And I'm like, this is scary because uterine cancer may occur. Because there may be a little something inside that you kind of stimulate with the estrogen, and you can't change progesterone and change hormones to try to manage bleeding. You've got to evaluate bleeding. So I would just encourage anyone who chooses to do that, and they're not close to me, then make sure they're a gynecologist, that they've been doing it for some time.
That is excellent advice. And I'm so glad that you mentioned it, because certainly, safety is number one. And we will be sure to find out exactly where you are and how people can contact you before the end of the show. Okay. But one of the questions that I really want to ask you, and it's a little bit of a deviation from what we've been talking about, but it's one of the questions that has come up for me in my practice, which is, I always say I help women to stop overeating, but usually women are hiring me because they want to lose unwanted weight. Mm-hmm. And I'm very much a girl's girl and all about body diversity. There's a portrait of Lizzo on the wall behind me, right? I'm all about it. So sometimes it's controversial, right? The idea of we really want to embrace aging and we want to embrace our bodies as they are, but yet some of us still want to change our bodies. So have you ever gotten that criticism of maybe what you're doing is detrimental to women because it is, encouraging some kind of feminine female ideal where we're constantly seeking youth and denying age? Have you ever gotten any of that, or has it kind of been, you've been home free in terms of that kind of criticism?
Well, I haven't gotten that because women who come to me are trying to be in this, they want to be in the C-suites. They're starting their own business and they want to be absolutely at their best all the time. So it's really about feeling better more so than vanity. And
yes.
And what I had to just realize, and especially being a woman of color, is, and I read this in an article, for some women, because majority of my women are not women of color. Some women, especially women of color, menopause is a part of life. It's not abnormal. You see it more in women of color. But in some women, they feel this transition and hot flashes or whatever is a natural transition of life to be embraced, and then you shouldn't fix it or do anything about it. You just use a fan. And I'm from the South, you don't go to a church in the South that doesn't have a fan in the pew with the funeral home's name, and if the preacher's really doing it, you got your fan, and every you see color purple, the sister's got the fan. So, having a little weight comes maybe is in some cultures is associated with what's doing well in life. Having a little weight, and it's not in all races. So I think it's important to just respect who your client is. This is why typically when I go out to places, I don't promote myself. I let people come to me because I have a meeting I go to all the time. There are two women there, probably in their early 50s, and they compare their fans. And I'm just sitting there. They sit these fans up in front of them and turn them on, and they compare their fans. And they have big fans here, and they got one here, and they just show off their different fans. And and I was like, why would to me, but that's what some people. So I think it's important to respect culture, respect someone's heritage, and allow them to be who they need. So I allow people to come to me. So people hear about us and they come to us because they don't like this. They don't want to feel how they're feeling, and they know it can be better.
Exactly. That is it. And that's what I love about your message, Dr. Jackson, that it's really about feeling better. It's not necessary. I think a lot of times when we think of vaginal rejuvenation, for example, and I know for me, this was certainly what came to mind when I first learned about it was, this is what we're doing now to make men feel better, right? Like I was thinking we're going into our vaginas to make them feel better. But that's not what it's about, right? It's actually about you feeling better.
A patient was here this morning, and I know her. She's a friend of mine. And I basically, you get older, and as women get older, the lips of the vagina deflate and droop. Yep. So I did hers today, and when I do the vaginal rejuvenation, it's immediate, the response. And I see where they walk out a little taller, or just got a little more pizzazz, and because I said, I always laugh, you got a little different point of view when you're cute down there, So,
that's right.
And so we really focus on a woman feeling better for herself.
Yeah.
I laugh because I'm writing a book. It'll be out hopefully in May. It's my Mother's Day. But I started writing it in 2010. And my God, the messaging I was writing in 2010 was all about keeping a husband and da-da-da, versus now it's all about self-care, self-love. And my ghostwriter and I had to really kind of totally change the book up, because the women in my world that come to me are really focusing finally on themselves. They've got it with their husbands. A lot of them are divorced or husbands are deceased, and it's all about them, no longer all about please keeping this husband happy. So
yes. Oh, I love that. I love hearing that.
Yeah. So we just want to be a part of a woman's natural ascension. Age 45, 50, the world is beginning for you. The children are grown. The marriage is there. Now you're free. And we want to just be a part of that ascension.
Yes. Oh, I love that. I love so much of this. Okay. So Dr. Jackson, I am sure that people are listening and they're like, I want to feel better. I want all of that. So tell people, where can they find you? How can they find you? Where are you in the world?
Well, I'm in West LA, right off the 405 freeway, about 20 minutes from LAX. And we are open the first Saturday of every month for our commuters. We have the ladies who fly in because it's once every 4 months. Everyone needs to come to LA quarterly, right?
Yeah.
So, but we have a lot of ladies who live in Palmdale, Lancaster, those areas who can come and near LA. And then most people just spend the day. They come and you come here and then they do a few things, but they just make it a part of their routine. So we're at the 405 at Olympic, specifically Olympic in Sawtell. And you'll have my address.
Yep. This will all be in the show notes.
Yeah. And then, so my website, you'll have that for them too.
Yep.
It's www.drgailjackson.com. It'll talk to you more about the hormone balancing and what we do, and answer a lot of questions that we're asked. And we also have weight loss products, weight loss opportunities. The Celebrity Fit Food Program, and then the vaginal rejuvenation. And Dr. Abby comes in and she does the PRP to the scalp. We have a lot of ladies as we get older, the hair thins around the scalp, and oh, they're getting great results. She's pretty busy. She comes about a couple of times a month. So we're trying whatever, and we're going to start PRP to the face because we just want to be the one source for women to just get it all done.
Yes.
H to T, okay?
I love that. H to T. That's right.
PRP H to T.
Right. That is so wonderful. And is there anything that you would love, my listeners, if you would just love, if they just took one thing away from the show today or one thing that you really want them to just know or feel, what would that thing be?
I think the most important thing to understand is you perhaps don't know what you don't know. And hormone balancing is great for now, but there are long-term, well-defined benefits of hormone balancing, and they are prevention of Alzheimer's and dementia, keeping those bones nice and long and strong. Because Lieberman died the other day from a fall. Because if a woman falls and she has osteoporosis, that's the most common cause of death for an elderly woman. Because the complications from being immobilized from osteoporosis, and osteoporosis is just simply prevented by a little bit of estrogen. Yeah. So I think the long-term benefit's important, and it's never too early to start. It's never too late to start because that just occurred to me. I said this was going to be your last thought, but I have one more question. When should we start this process? Is it when symptoms first start coming on, when we're suspicious, because I'm 46 and my mom's like, oh, I went through menopause at 51. But of course, what she means is that's when her period stopped at the 12-month mark. But now we know that these things start hitting us way before that. So when should somebody seek out services like yours? I think when a woman in her 40s starts feeling something's not right.
Yeah.
And because I think we minimize the importance of sleep. If you don't have a good night's sleep and a good bit of rest, you can't function that day or a lot after. And so I think majority of our women come initially for sleep and weight and the inability to lose weight. So when anything comes up, don't feel like there's not anything that can be done. If you find you're snapping at people a little more or a little edgy, but mostly the sleep and losing weight, then just seek out me or seek out a professional with hormone balancing, because it's probably an early symptom of testosterone deficiency. Okay. As again, we see that in the early to mid 40s, and then as we hit 50, the estrogen diminishes.
Okay.
Yeah.
And then is it ever too late? Like never too old?
Never too old to start. No.
I love it.
And we have some ladies that come for a bit and then they disappear because they're like, oh, I was fine. Then about a year later, so what? I'm like, oh, I love to be missed. Oh my God, I love to be missed.
Yes. Well, Dr. Jackson, I'm so grateful that you came on the show today, because I know that just being here today, you have helped so many women. And you're right. Everybody needs to go to LA at least once a quarter, and you're 20 minutes from the airport. But really, mostly it's this messaging, right? That it doesn't have to be miserable. It doesn't have to be this way. Even though it's confusing and feels awful initially, there is help and there is support from doctors like you, and others if you're really not in the LA area. So grateful to you for coming on the show today.
It was my honor. And thank you for inviting me. And I look forward to seeing you the next event.
Definitely. Me too.
Yeah.
You've been listening to The Life You Crave. I lost 30 pounds years ago without dieting, willpower, or deprivation. I'm on a mission to help other women, including you, do the same. You can book a free weight loss strategy session with me over at leahpinelli.com. That's LIAPINELLI.com. See you on our next call or on the next episode. And remember to like, subscribe, and leave a comment on iTunes.